EMR ataupun EHR, ya, kita akan dapat saksikan bahawa the entire country will be connected into a seamless, where there will be only one citizen, one record, the master patient index, and everywhere a patient goes, he or she must be only asked the same questions once.
Okay, so that clip perfectly illustrates the fast-paced world of healthcare we live in today. But behind every medical miracle and every public health announcement is a vast network of information. This brings us to our case study for today, Kementerian Kesihatan Malaysia, or better known as KKM. KKM is the backbone of our nation's health, responsible for everything from public hospitals to health policy. However, from a records management perspective, KKM is also one of the largest information factories in Malaysia. They don't just manage patients, they manage records, millions of them, that must be authentic, reliable, and accessible for years to come. Okay, now, relating to our topic, which is topic 7, developing and emerging technologies. So, as we transition into the digital age, KKM is a prime example of this topic. They are no longer just dealing with paper files. Today, KKM is navigating through these three factors, which is, first is social media. Using platforms, KKM using platforms like Facebook and Twitter, which is right now Twitter, also known as X, to disseminate vital health info, which effectively creates social media records that must be captured and preserved. Second, emerging tech. They are exploring blockchain to improve medical health information interoperability, ensuring that patient data is immutable and trust is maintained across different healthcare providers. So the third one is transporting. Through big data, KKM is now transporting, which is using data to predict disease outbreaks before they happen, moving from reactive to proactive healthcare. So let we think together. But is KKM's records management framework ready for these emerging technologies? Today we will analyze their current strategies, identify the risk of a laissez-faire approach to digital data, and provide recommendations to ensure their information governance is as healthy as the citizens they serve.
I will now continue with the next 4 issues related to misfiled and missing patient records in government hospitals. The 5th issue is scalability and legal issues with blockchain. While blockchain is a strong emerging technology for securing records, it faces scalability challenges. For large government hospitals, processing thousands of patient records daily can be slow and costly. In addition, legal regulations for using blockchain in healthcare are still not fully established. The 6th issue is human error and missing metadata. Many clinics still rely on manual digital record-keeping methods such as screenshot or copy-pasting information. This often causes important metadata like timestamp or the identity of the record creator to be missing, making the record less reliable as legal evidence. The 7th issue is poor integration between hospital systems. Different departments may use separate record systems that are not connected to each other. This can result in duplicate records, misfiled data, or missing patient information. The 8th issue is the lack of staff training in digital records management. Without proper training, staff may not fully understand how to use digital record system correctly, which can lead to errors, incorrect storage, or loss of patient records. In conclusion, these issues show that without proper management, emerging technologies can increase the risk of missing or misfiled patient records in government healthcare facilities.
Current issues at health clinics or hospitals. The first issue is that many modern hospitals use the Internet of Things or IoT, such as connected heart monitors. Unfortunately, these devices are often vulnerable to cyber attacks, which means hackers could potentially access or change sensitive patient medical records, putting lives at risk. Secondly, security risks in cloud storage. While storing records in the cloud allows doctors to access data from anywhere, it also creates a major security risk. Without advanced access control and encryption, private health information could be leaked if the cloud service is not properly secure. Moving on to the next point, difficulty in capturing social media records. Many healthcare organizations use platforms like Facebook or WhatsApp to communicate, but They often fail to capture these interactions as official records because these records are hosted by third-party providers. The hospital may lose important evidence if a post or message is deleted. Moreover, there is also a lack of real-time monitoring for digital communications. If a hospital staff member accidentally shares confidential patient information on social media, the organization may not catch the error immediately, leading to the serious legal breaches and a failure to comply with privacy laws.
Next is the solutions that healthcare organizations have implemented to improve digital records management. First, for the vulnerability of connected medical device or IoT device, hospitals implemented stronger cybersecurity measures. These include encrypting data transmitted by IoT device, applying device authentication, and performing regular system updates. Hospitals also introduced real-time monitoring system and restricted access to authorized medical staff only. This helped protect patient information and improve overall patient safety. Second, regarding security risks in cloud storage, hospitals adopted advanced access control system and encrypted patient data stored in the cloud. Only authorized personnel will be allowed to view or modify records, which help reduce the risk of data breach. Third, for the difficulty in capturing social media records, healthcare organizations use automated social media archiving tools such as Page Freezer and Smash. These tools capture posts, comment, message, and metadata in real time, ensuring that social media communication will preserve as official records even if later deleted. To address the lack of real-time monitoring and compliance, hospitals implemented real-time monitoring and compliance tool. Social media monitoring system were used to track digital communications and automatically flag non-compliant content. This allowed hospitals to respond quickly to privacy breach and maintain compliance with healthcare regulations. Regarding scalability and legal issues with blockchain, hospitals adopted blockchain selectively. Blockchain was used only for critical records such as patient identity verification and record integrity. Hospitals combine blockchain with traditional record management system to balance security, cost, and efficiency while waiting for clearer legal guidelines. Next, to reduce human error and missing metadata, hospitals replace manual record-keeping methods with automated record management system. This system automatically captures complete metadata, including time, date, and user information. This improves record accuracy and strengthens records for legal and compliance purposes. Next, for poor integration between hospital systems, hospital implemented an enterprise content management or ECM system. The ECM system integrated records from all departments into a centralized platform. This improved data consistency, reduced duplication, and ensured complete patient information across the organization. Finally, to address the lack of staff training in digital records management, hospitals conducted regular training and awareness programs. Staff were trained on digital record system, record management policies, and compliance requirements. This improves staff competency, reduce errors, and ensure proper handling of digital records.
Next, I will talk about future implication. Can you imagine going to a hospital and your medical records are already available on the computer within seconds? In the future, digital health record system in Malaysia will continue to grow and improve. More hospitals and clinics will use digital system to store and manage patient information. New technologies such as artificial intelligence, AI, and cloud storage will help doctors and nurses access patient records faster and make better medical decisions. These technologies can improve healthcare service and save time. Malaysia may also develop a national digital health record system. This system will allow patient records to be shared safely between hospitals and clinics when needed. This will help improve patient treatment, especially in emergency situations. However, as digital systems increase, the risk of data breach and cyber attacks will also increase. Personal health information may be stolen or misused if it is not well protected. Because of this, strong records and information governance is very important. Clear rules, proper security control, and trained staff are needed to protect patient records. In the future, records management professionals will play a bigger role in ensuring that digital health records are safe, accurate, and well managed. In conclusion, although digital technologies such as blockchain, cloud storage, social media, and connected medical devices bring many benefits to healthcare record management, they also create serious challenges. Issues such as scalability and legal concerns in blockchain system can affect the reliability and legal acceptance of health records. Human error and missing metadata may reduce the accuracy and value of digital records. In addition, poor integration between hospital systems make it difficult to share patient information efficiently. The lack of proper training in digital records management also increases the risk of mistakes and non-compliance. At the same time, connected medical device and cloud storage system are vulnerable to security threats which can expose sensitive patient data. Furthermore, the difficulty in capturing social media records and the lack of real-time monitoring and compliance can weaken accountability and transparency. Therefore, effective records and information governance is essential. Strong policies, secure system, continuous monitoring, and proper staff training are needed to ensure that digital health records are accurate, secure, and trustworthy. By addressing this challenge, healthcare organizations can manage emerging technologies more responsibly and build a safer digital healthcare system for the future.